Okay, let's continue with the electric drum. Juan Castillo here. Electric drum, of course, in full effect. And in the studio, I have with me Dr. Michael Yungaitis. He's with the Great Expressions Dental Centers, and they have a great campaign that they're doing right now. How you doing today?
Great. How are you?
All right, so tell me about what you guys are doing right now.
So for the month of April, we are doing a oral cancer awareness month screening for all of our patients, as well as any new patients who want to come in. And we do it with Oral ID, which is a fluorescent light that we shine that helps us detect cancer at an early rate.
So now, what age groups should be getting tested for this?
So I recommend all age groups to be tested. Obviously, the older populations are more at risk, but I recommend at least every 6 months to get screenings for oral cancer.
Really? So when you go to the dentist for just regular checkups, you should be asking for that.
Absolutely.
Wow, that's interesting because my dentist has never asked me that.
Most dentists do the oral screenings. They may not acknowledge to the patient that they're doing them, but they should be regularly doing them with every exam when they come into the room.
Right. Now, how do you develop oral cancer?
There's a couple different risk factors. The most common that everyone thinks about is smoking, but it's a misconception that smoking is the only cause of oral cancer. And there's been other things that can attribute to that, whether it be genetic susceptibility or mutations, which are kind of bad changes in the cells, or some viruses can actually cause oral cancer too. Right. So with the decrease of the amount of smokers in the population, because we've seen a steady decline in that, but we've seen a higher proportion of the cancers that are not related to smoking because there's less people getting the more prominent smoking cancers.
Right. And so, I mean, is anything visibly in your mouth that can make you sort of think about it?
Usually a white area that's non-wipeable, but it should be seen by a licensed dentist or licensed healthcare professional, because there's a lot of things that can appear to look like cancer, but then it turns out that it's just irritation from either cheek biting or something like that. Right. But it's important to get this looked at and make sure that it's nothing. Right.
Now let's talk about you a little bit. You mentioned you were from South Boston, right?
Yeah, originally.
Yeah, originally, right. Tell me about growing up there.
It was nice. I'm definitely a New England sports fan, and I used to love going into the city whenever you could just hop on the train. But I've been a Connecticut transplant now for a while. I went to UConn undergraduate as well as UConn dental school, and then a 1-year general dentistry residency program also at UConn.
Did you always want to be a dentist, or how did that come about?
So my uncle was a dentist, so I always enjoyed going to the dentist.
Right.
And I was always good in math and sciences, so it just kind of felt like the right fit for me. I've always been good with working with my hands.
Right.
And it's very artistic as well. So I just kept on gravitating towards it.
And it's so important, right? Because that smile and just feeling good about yourself, man.
Absolutely.
When you got great teeth. Well, listen, I want to thank you, for all the work that you're doing, to make this community aware, that they need to get tested for oral cancer. And you guys are going to be doing this all month, and it's free, right?
Absolutely.
All right. So tell me how the folks get in contact with you.
They can give the office a call, 203-795. 20